Good afternoon. Thank you so much for joining today's Veterans Town Hall. Today's event will be organized a little differently. You will learn more about our hospital information and the options for you to choose your healthcare needs in our VA system. If you are new to the VA or exploring your options, our team will outline the benefits of our VA healthcare system and help guide your journey. Most importantly, we will focus on resources, programs, and information designed to help our current patients, families, and caregivers. This is a broader effort to offer veteran town halls in person during our summer and winter seasons. Your opinion is the most important, so we want to ensure you have a chance to share insights with Hines leaders. Lastly, we will hold an open forum at the end of today's town hall. For patient and privacy reasons, we will end our virtual segment before the question and answer session begins. But don't worry, veterans can still reach out to us on our social media platforms, as well as calling us directly at 708-202-8387. And with that being said, I will now turn it over to Francisco Machizi for our safety story.
Thank you, Dr. Morris. Veterans, staff, good afternoon. This rainy day, the safety story is as follows. A veteran was discharged from the Blind Center and returned to his prior residence, a nursing home. Upon arrival, the nursing home declined to accept the veteran due to a contractor stipulation preventing absence for more than 30 days. Consequently, the veteran was transferred back to Hines Emergency Department for temporary admission until a new console could be placed to facilitate his transfer back to the nursing home. A subsequent JPSI investigation assessed the discharge process for veterans and concluded that communication was insufficient. A fast response team composed of key personnel was established to review the incident and develop preventive measures to then facilitate a revised process to enhance the discharge communication, particularly for destination regarding ongoing medical follow-ups. This incident underscored adherence to the high availability organization principle of maintaining preoccupation with failure to proactive solutions, avoiding oversimplification by addressing the root cause and demonstrating commitment to resilience by implementing improved discharge communication protocols at the Blind Rehabilitation Center. And that concludes safety story, followed by Dr. Richardson.
Thank you very much, Mr. Marchese. And for my medical update today, I think I want to start off by saying that our summer is coming to a close, and lots of things are happening. Most importantly, I think at the moment, we are naturally having very challenging weather at the end of summer. And therefore, I want to say that we must be careful to check your emergency plans, to make sure not just for your medical areas, but certainly for personal and family situations as well. The challenges also, from a medical point of view, creates anxiety in many of us, and that's natural. But at this time, I would say also remember to look and think about the rest, about what rest you get, sleep, what nutrition you have, and therefore also what medications you may take or you may need as to whether you need to become another encounter. The end of summer also marks our back to school and vaccinations for the family members, for children in the school is necessarily important. And from our point of view here, the families that have children that are going back to school have definitely an increased infectious potential for coughs and colds, and as we come up into September, for influenza. And as you remember, we recommend for people at extremes of age, particularly people who also have chronic medical conditions of lung or heart or transplant, but some chronic conditions of diabetes, hypertension, we recommend that you get your flu vaccination every year. And this will be available probably from the middle of September onwards. And for veterans who are also employees, we say this vaccination is mandatory and needs to be done and recorded that it has been done. So these are the things really for update that I want to make sure one remembers. And I'm going to then put it over to our Ms. Jankowski to talk about our local games and our adaptive sports exposition.
Thank you. Good afternoon, everyone. On behalf of the event planning team here, excited to invite all of you to this year's local games and autumn adaptive sports expo. This event will be taking place on Saturday, September 26th, right here on Hines campus. This year is especially meaningful as the event will mark the official opening of the SCID Veterans Adapted Sports Court, a new space dedicated to expanding inclusive and empowering recreational opportunities for our veterans. The event will be held outside of Building 221, the residential care facility. We'll kick things off with a veteran walk, followed by a variety of athletic and recreational resource tables, hands-on expos featuring events typical for our national competitions, and plenty of chances to explore new activities and connect with fellow veterans. Thanks to the generous support of the Gary Sinise Foundation, free food will be available for all attendees throughout the day. Additional details regarding parking, check-in, a detailed timeline, and other important details will be shared on our Facebook closer to the event. We would truly love to see you there participating, cheering, connecting, and celebrating the spirit of community and competition that makes the Hines local games so meaningful. Next, you'll be hearing from Michael White.
Good afternoon. My name is Michael White. I want to go over why we would choose VA here at Hines. Primary reasons: to get regular checkups, specialty clinic care visits, urgent care, access to prescriptions and prosthetics and medical equipment. All the benefits that you've earned when you served on the active duty military. Here at Hines, we also have 6 other clinical sites for your convenience. They are the Aurora Clinic, Hoffman Estates, Joliet, Kankakee, LaSalle, and Oak Lawn VA Clinic. Now, to keep people from following through the myths, we're going to debunk some of these myths. A lot of these I like myself. The first is, I didn't serve in combat. I was injured, so I'm not eligible for VA health care. Fact check, that is not true. If you served in the military during peacetime and separated under any condition other than dishonorable, you may qualify for your VA health care. Myth 2, I do not want to go to the VA because I want to save those appointments for those who really need it. Fact check, we receive fundings based on the number of veterans who used our services. By choosing VA for your health care, you're not taking away from others, you're helping expand our access for every veteran. Myth 3, I want to go to VA, but I don't want to lose my private health insurance. Assuming that you are eligible for VA health care, you do not need to give up your private health insurance. You can keep both. You can keep your private insurance and your health care benefit too, the best of both worlds. Myth 4, I make too much money, so I have never applied for VA health care. I hear this one a lot. Eligibility is not just about income. There are many other factors to consider when applying for VA health care, including service-related conditions, time and location of service, and others. Myth 5, I have a service-connected rating or disability rating through the VA, so I am already enrolled in the VA health care. Unfortunately, that's not true. Disability benefits don't automatically enroll you. You must still apply for your VA health care. The good news is that a service-connected disability is a qualifying element or factor for your eligibility. So the idea is to have everything in one spot. VA comprehensive health care services can improve your health care and well-being while saving you thousands of dollars. If you don't need your care today, you may need it tomorrow, maybe 20 years from now. Once you do, you're in for life. Okay. What can help the VA healthcare mean for you? Comprehensive healthcare, no insurance needed, vision and hearing care, mental health and whole health services. You also get urgent care access, virtual visits, prescriptions made simple. You can just log in and you can update those prescriptions through the app or using my VA or VA healthcare and benefit app, as I just noted. Travel reimbursements, easy check-in, you just need your valid ID, community care, and dental care for those that qualify. So how do you find out if you're eligible for VA health care? Because your service does matter. If you served active duty or reserved the National Guard, or if you were called to duty by federal order and completed that service, even during peacetime, you may qualify for your VA health care. Before you get started, these are the things that you'll need. Your discharge papers, which are your DD Form 214, your most recent tax return, the Social Security numbers for you and your dependents, and your insurance cards if applicable. Once you have all that, I want to take a minute here and say it's easier, and I want to encourage everyone to go directly to Hines VA Eligibility Service and have a face-to-face enrollment with them. Our clerks are excellent and they can answer all your questions. But if you can't, you can do it online, you can do it by phone, or you can mail in. Your snail mail still does work. Just make sure that you have the applicable VA health form, VA form 1010EZ. After you applied, you'll be notified within the first 5 days of your application. You'll get a welcome call, which will welcome you to VA services, and they will set up your vesting appointment with your primary care doctor. You'll get a confirmation letter for next steps, and you'll also get a VA handbook to answer some of those frequently asked questions about VA healthcare in your priority groups. But again, I want to encourage you to come in to do it face-to-face, because once you enroll in face-to-face, you'll also get that first scheduled appointment before you leave. If you have any questions about your VA healthcare after the fact, you can go to va.gov and log into the portal. You can revisit your VA health kit once it gets there. It's very comprehensive, and hopefully it can answer your questions. Or you can just go through the VA, my VA Gov, and use the app. And now I'll be turning the service to Ms. Candace Kent.
Hi everyone, my name is Candace Kent. I'm the Acting Patient Administrative Services Chief here at Hines VA, and I've come to you today to talk about patient administrative services, what we do, and the impact we have on your healthcare journey. So who we are. In the VHA, PAS provides critical frontline administrative and clerical support. We are here to assist you in scheduling and ensuring that you're able to communicate with your clinical team in an effective and timely manner. Next slide. So what we do do patient check-in, appointment scheduling, communication, records management, and clinic coordination. We greet and screen veterans as they arrive for appointments. We book, cancel, and reschedule clinic visits, and we answer phones, route messages to clinical teams, and guide patients through the facility. Additionally, we update patient demographics, insurance information, and process electronic wait lists. And then finally, we review provider orders, track consult requests, and prepare rooms or charts for daily visit. As I like to say, if you have a PCP here at Hines VA, you have an MSA that's also assigned to you to assist you with your care. Our key objectives within PAS is to ensure veterans are able to easily navigate health services, that we provide veterans with personalized, proactive, patient-driven health care, foster the delivery of effective and easy customer experiences in which veterans feel valued, and maintain strict alignment with national VHA directives, practices, and external accreditation. We are measured through various channels to include the PASS-R system, the SHEP survey, and veteran signals, reaffirming that your voice matters in the care you receive, and we're always striving to ensure we're providing the best care and experience to our veterans. Next slide. So what's new? Remaining in alignment with VHA directives, it is important that when you check in for your clinical appointments that you have a ID, be it your VA ID or your state ID. This to ensure the safety and security of those who get care here at Hines VA, and also that of your fellow comrades and battle buddies. Now, by chance, if you do not have your ID, we will answer some or ask you some challenge questions, and this is again to verify your identity. We will never turn away veterans here or patients who are seeking care, but we will take necessary steps to ensure we can verify who you are, and again to ensure your safety and security is not compromised. Next slide. And also customer experience. As I said before, our goal is to provide a 5-star experience to those we serve. So as PAS MSAs on the front line, they are to provide proactive communication and check-ins. As you check in for your appointments, if there's any delay or any issues, they are to be advising you of such to make you aware of current issues and next steps. Also, we are responsive to veteran needs. Our MSAs are attentive, responsive, and ensures concerns are addressed quickly. We provide clear, accurate scheduling and support. Again, we are the gatekeepers, ensuring that veterans are able to access their care in a timely manner and properly escalate any urgent issues. Strong coordination and communication with providers. As stated before, we work in collaboration with your clinical team to ensure you're getting the care that you need in a timely manner. So ensuring we're having that great communication and teamwork with the clinical team is very important. And then lastly, but most importantly, we want to create a supportive and positive experience for you as veterans when you're getting your care here at Hines VA through kindness, professionalism, and advocacy. Next slide. And if by chance we miss the mark or we surpass your expectations, we want to hear about it. Please contact myself, Candace Kent, at 708-743-1100. And if you don't feel comfortable talking to myself, please contact the Patient Advocate Office at 708-202-2716, because as always, your feedback matters to us. And next we have Mr. Mordican with travel.
Good afternoon, everyone. My name is Khalil Mordican. I am a transportation assistant with Hines Beneficiary Travel Department. Located here at Edward Hines in Building 1, Room G100. I'm here today to explain the benefits as it relates to the Hines Beneficiary Travel for veterans that are administratively eligible for the program. And to start our experience through travel, I will begin explaining the Veterans Transportation Service. The Veterans Transportation Service helps qualifying veterans access health care through safe, convenient, and reliable transportation. It provides free transportation to and or from participating VA medical centers, transportation to VA facilities and authorized non-VA appointments. We provide service in multi-passenger and wheelchair accessible vehicles, depending on the veteran's need. Finally, we also provide support for veterans who lack transportation because of financial, medical, and or mobility issues. Veterans may qualify when they are eligible for VA healthcare benefits, have a VA authorized appointment. Veterans may also qualify when they are requiring transportation because they do not have suitable options on their own. Meet the ridership guidelines established by their local primary VA facility, and the transportation options include wheelchair accessible vehicles, door-to-door vehicles for ambulatory veterans, and also a fixed VA C-Box shuttle route. Our intended riders include veterans that are eligible for special mode transportation, SMT for short, mobility challenged veterans who are unable to drive, and other eligible veterans based on seat availability. Some mobility challenges include visual impairness, medical fragility, wheelchair dependence, and other conditions that prevent safe driving. VTS offers transportations to VA medical centers, community-based outpatient clinics, other VA medical facilities, and authorized non-VA healthcare appointments. For eligibility of travel, we have veterans whom are 0% to 20% service connected, who are only eligible to claim travel reimbursement for appointments that have to do with their service connection. Veterans who have 30% or higher service-connected disability rating are eligible to claim reimbursement and receive transportation for all appointments regardless of the appointments being related to their service connection. We have veterans that fall below our low-income threshold that are eligible for reimbursement and transportation. Finally, we have veterans receiving a VA pension benefit that are eligible for reimbursement and transportation to all appointments. To schedule a ride with your VTS, contact your local VTS office as early as possible within an allotted time frame. A staff member must confirm that you have a VA authorized appointment to transport you. Provide appointment, date, time, and location. Explain any mobility or accessibility requirements needed. State whether a companion or attendant will accompany you for the vehicle trip. Confirm your pickup location, pickup time, and arrangements for your return. Some of the key takeaways that we may have here are going to be that VTS provides free transportation for qualifying veterans. Transportation is available for certain VA and authorized non-VA appointments. Options may include door-to-door rides, wheelchair accessible vans, and fixed route shuttles. Eligibility and services vary by participating VA facilities. Wheelchair needs and companion requests should be disclosed when scheduling the trip. This is going to be our information to reach us at any given time. Our number is going to be 708-202-2568. Next, I'm going to pass the torch over to Mr. Matthew Moeller with the smoking policy.
Hello everyone, thank you for joining us today. My name is Matthew Moeller, I'm the Public Affairs Officer here at Hines, and I'm going to address the smoking policy. The big thing to remember for the smoking policy at any VA facility, not just Hines, any VA healthcare facility, is smoke-free. You cannot smoke in any capacity here at Hines. That includes vaping as well. This is effective October 1st, 2019. So this is not a new change, but still a change that a lot of our veterans aren't familiar with, so we want to reinforce it here today. And remember, it's not just inside buildings. You can't step outside and smoke, unfortunately. You have to leave campus. That is anything with outside of the wall perimeter of Hines or off the parking lots of our CBOC locations. Next slide, please. Now, for those of you who want to stop smoking, there's a couple things that VA can do for you. First, if you're more tech savvy, there's the Stay to Quit Coach 2 app. It's available on either your Apple or Android app stores. It offers just motivation every day as well as the ability to set goals and track your progress. And it's just a really great tool that a lot of veterans have had really great use for. Another one is the Smoke-Free Vet Text Program. This you can sign up for right now by texting 47848. You just text VETS and then you'll get daily texts about how to quit smoking as well as encouragement and quitting tips. If Spanish is your first language, they also have the option available in Espanol. All you have to do is text 47848 and it's VET-ESP. Also, I recommend VA's free telephone quit line. That's 855-QUIT-VETS. This is just a really great way if you are feeling a craving, need to call someone, you talk it out, or just want more resources, you can give them a call. And you can also reach out to Hines, of course. We have a smoking cessation program here that is top-notch and has helped so many veterans. Chloe Serpico, as you can see on your screen, is the point of contact. Or you can talk to your primary care provider about the resources available to you. There are many resources. We want to help you stop smoking to those who want to stop. And that's smoking, vaping, Zyn tobacco pouches, dipping, any tobacco use that you feel you need to stop, we can help you along the way. And that's it for me. Next up, I'd like to welcome Sarah Craner from our Patient Advocate Office to discuss veteran experience.
Hello everyone, my name is Sarah Craner and I'm the Acting Veteran Experience Officer here at Hines. We continue to have a successful year within the Veteran Experience Office, working hard to ensure that you have the best experiences possible. As a reminder, we opened a Veteran Resource Center, which is a collaborative partnership with our veteran library, My Healthy Vet, and our patient advocates. This is located in Building 1, room F155. Today, I wanted to start by talking a little bit about the role of the patient advocate and how our services fit into the overall mission and goals of the facility. At Hines, we have 5 social work patient advocates who work on behalf of the director to ensure that both concerns and compliments are addressed accordingly and to national standards. It is our goal to ensure that each veteran issue is handled respectfully and routed to the subject matter experts who can work with the veteran and family to obtain a timely and complete resolution. We use this information to track trends in the data, which are also reported to leadership and used for system improvements. The National Office of Patient Advocacy mandates that when a concern or compliment comes through the office, these cases are worked from initiation to completion within 7 business days. Nationally, facilities are informed that they should have no more than 12% of their cases overdue at any point in time. At the VISN level, the goal is 10%. For Hines, our overdue rate is typically under 5% and most recently was at 2.6%. This highlights the hard work and dedication of our advocates and staff here at Hines who work diligently to address all concerns brought to their attention. I would also like to share our overall trust scores from the last 90 days as reported through the Veteran Signals Survey. The current VISN 12 trust score is 94.6 when averaging the data from all of the associated facilities. I'm proud to announce that the overall trust score from Hines from the last 90 days comes in above that VISN rate at 95%, and this has improved even since the last time we updated these slides. I wanted to highlight that in addition to concerns, the Patient Advocate Office also tracks compliments that are obtained through a variety of VA-approved sources. In the last 90 days, the Hines Patient Advocates have received over 330 compliments for our staff. Lastly, I wanted to reiterate that we really do look at and appreciate veteran feedback. This information is very valuable to us and does help us to make system improvements. If you receive a survey, either by mail or email, please take the time to complete it. Surveys are just one way we obtain feedback, and you can also submit a comment on askva.gov or connect with the Hines Patient Advocate Office by phone, in person, or by sending a secure message. Your voice matters. We want to know what we can do to continue to improve the care that you receive here at Hines. Thank you so much for your time. And next up is our open forum led by Miss Angela Morris.
Thank you so much. Thank you all for attending today. Before we start our Q&A, we will wrap up our virtual discussion so we can maintain the privacy of our attendees. But please note that our next Veteran Town Hall will be virtually held on October 15th. And our next in-person town hall will be held in January 2027. We will make sure all of those updates is located on social media where you can visit our sites to get more information as we have more events in the future. Thank you so much, and that concludes today's town hall. Take care.